Insomnia is the most common sleep disorder in the clinic. In adults, the diagnostic criteria for insomnia are as high as 10 to 15%, and it is a chronic disease. Insomnia seriously damages the physical and mental health of patients, affects their quality of life, even induces traffic accidents, and endangers personal and public safety. It is a serious burden to individuals and society. Insomnia means insufficient duration of sleep, or sleep of poor quality. In mild cases, it may be difficulty in falling asleep or frequent waking from sleep. In severe cases, it may be an inability to fall asleep all night. In general, insomnia may be caused by exogenous illness or by internal injury. Exogenously induced insomnia most commonly occurs during the course of various illnesses of heat. Endogenously induced insomnia is primarily due to deficiency. In today's video, the emphasis is on endogenously induced insomnia. The first session today is etiology and pathology. A weak constitution or a chronic illness can cause insomnia. The constitution may be inherently weak or weakened by illness. Most illnesses can weaken the constitution through injury to the heart and the spleen, impairment of the generation of qi and blood, failure of nourishment of the heart, or blood depletion. Exhaustion of kidney yin, flaring of heart fire, and disturbance of the mind can also cause insomnia. Emotional disorders are also common causes. Excessive brooding injures the heart and the spleen and may result in failure of heart nourishment. Sudden and violent fright may lead to the deficiency of heart and gallbladder qi and conduce to the production of phlegm and heat. Pent-up rage impairs the liver, conducing to stagnation of liver qi and its transformation into liver fire, and liver fire in turn can disturb the mind and induce insomnia. An immoderate diet with excessive consumption of spices, fats, and sweets over a long period of time can impair the spleen and the stomach. These organs may fail in their transformation functions, permitting dampness to accumulate. If dampness is permitted to gel, it may produce phlegm and give rise to heat. Phlegm and heat together can cause obstruction in the middle burner and upward disturbance of the mind, leading to insomnia. Excessive resting with too little activity can lead to the deficiency of spleen qi so that the spleen fails in its transporting and transforming functions. The essence of foods and drinks becomes unavailable for the generation of qi and blood, so that the nourishment of the heart fails, and this also leads to insomnia. So, how to make an appropriate diagnosis? Here are the key points of analysis. First of all, types of insomnia. The clinical features of insomnia are related to its cause, its severity, and its duration. In general, if the patient is able to fall asleep but readily awakens and then is unable to fall asleep again, it is mostly due to insufficiency of both the heart and the spleen. If difficulty falling asleep is associated with restlessness, palpitation of the heart, after sores in the mouth, and mouth dryness in the night, it is mostly due to flaming fire in yin deficiency. If the patient falls asleep readily but wakes up with a fright and is generally fearful and irascible with a frequent sighing, it is mostly due to insufficiency of the heart and the gallbladder, or blood insufficiency and liver hyperactivity. Secondly, visceral organ affected. Because different visceral organ dysfunction can produce insomnia, its associated symptoms also differ. For example, if insomnia is accompanied by anorexia, loss of taste, postprandial epigastric and abdominal distension, loose feces, sallow complexion, foul eructation, or acid regurgitation, it is mainly due to illness of the spleen and the stomach. If insomnia is associated with frequent dreams, dizziness, headache, and forgetfulness, it is mainly due to an illness of the heart. Finally, deficiency of strength. Insomnia may be the deficiency of strength type. The deficiency type is mainly due to qi and blood deficiency, so that the heart loses its function of nourishment, or due to yin deficiency with strong fire. This type is commonly associated with restlessness. The strength type is mainly due to flame and heat, causing an upward disturbance, and typically show agitation, irritability, a bitter taste in the mouth, and a dry throat, constipation, and dark urine. The next section is about traditional medicine syndromes. There are 6 traditional medicine syndromes related to insomnia, which are usually met in clinical practice. First of all, hyperactivity of the heart fire. In addition to insomnia, the patient may suffer from dysphoria, restlessness, a dry mouth and tongue, sores in the mouth and on the tongue, and scanty dark urine. The tongue tip is red with a thin yellow coating, and the pus is rapid. Second, deficiency of both the heart and the spleen. Difficulty falling asleep, or frequent dreams and waking easily, followed by difficulty falling asleep again. Sometimes accompanied by palpitation of the heart, panic, lassitude, and weakness, tailorlessness or postprandial abdominal distension, and a sallow complexion. The tongue is pale with a white coating, and the pus is even but feeble. Often there has been recent major surgery, blood loss, or anemia. Females often have had uterine bleeding or excessive menses. Thirdly, strong fire due to yin deficiency. Difficulty falling asleep with restlessness, hardness in the palms and soles, night sweat, dry mouth, and throat with thirst, or lingual and buccal of throat sores. The tongue is red, or only the tip of the tongue, and the coating is scant. The pus is thread-like and rapid. Fourthly, stagnated liver qi turning into fire. Difficulty in falling asleep. When asleep, frequent dreams, sometimes nightmares, restlessness, irritability, chest and subcostal fullness, dizziness, head distension, tinnitus, constipation, dark urine, a red tongue with yellow coating, and a tough and rapid pulse. Fifth, flame heat disturbing the interior. Insomnia, agitation, a bitter taste, dizziness with a heavy head, chest tightness, nausea with irritation, and much sputum. The tongue is reddish with a yellow and greasy coating. The pulse is slippery and rapid. Finally, disturbance of stomach qi. Insomnia accompanied by indigestion, epigastric distension or pain, nausea or vomiting, acid regurgitation, or malodorous feces or constipation. The tongue coating is yellow and either greasy or dry. The pus is tough and slippery, or rapid and slippery. And the next section is herbal treatment. The goal of treatment is to regulate qi and blood, balance yin and yang, and restore the normal functions of the visceral organs. At the same time, it is important on the basis of the clinical circumstances to select an appropriate method to calm the mind. The first syndrome, hyperactivity of the heart fire. Therapeutic principle, purge heart fire and calm the heart and the mind. In this situation, we can use 注射安神丸. Second, deficiency of both the heart and the spleen. Therapeutic principle, strengthen both the heart and the spleen, nourish blood, and sedate the mind. In this situation, we can use 桂皮汤. Third, strong fire due to yin deficiency. Therapeutic principle, nourish yin to suppress fire, clear heat in the heart, and sedate the mind. In this syndrome, we can use 黄连阿胶汤. Fourth, stagnated liver qi turning into fire. Therapeutic principle, clear the liver to reduce fire, calm the heart, and sedate the mind. In this situation, we can use lũng tạng xia can thang. Fifth, flame heat disturbing the interior. Therapeutic principle: dissipate flame, purge heat, nourish the heart, and sedate the mind. In this situation, we can use 净火抵痰汤. And finally, disturbance of stomach qi. Therapeutic principle: settle the stomach and relieve indigestion. Mild cases are commonly treated with 保和丸 or 月至丸, augmented with 山楂, 麦芽 or 来福子. Severe cases are more appropriately treated with 调味整气汤. And finally, acupuncture treatment. Acupuncture is quite effective in treating insomnia. The most commonly selected acupoints include 神门, 三阴桥, 杏树, 神树, 照海, 涌泉. Depending on the clinical circumstances, some acupoints may be omitted or others included. For insufficiency of heart blood, select 中丸, 济海, 三阴桥, 百会, 通理. Apply the reinforcing method and add masturbation. For blazing fire due to yin deficiency, select 通理, 内观, 少府, and 三阴桥. Apply the reducing method and retain the needles for 20 minutes. For disharmony of the stomach, select 中丸, 内观, 公孙, 凤龙, 内听, and 神门. Insert with mild reinforcing and reducing method. For hyperactivity of the liver and the gallbladder fire, select yan bai, gan shu, dan shu, and tai zhong. Insert with reducing method and reserve the needles for 20 minutes. And one thing should be remembered: acupuncture treatment should be applied 2 hours before sleep. And that's all I want to say in this video. Thank you so much for watching and see you next time.